reason.
Okay. At some point in time, we'll all experience being ill and we're going to require hospitalization. During this difficult time, everyone deserves skilled, competent care. As a licensed nurse, I'm going to take you through what's called the nursing process, and that's a process that we nurses take to ensure that our patients are getting good care. The first step of the nursing process is your data collection or your assessment. This is when you're going to go into the room and collect or assess your patient. Your assessment findings are going to help you determine to tell the doctor what needs to be done with the patient. Your assessment findings can be with or without use of equipment. The ones without your use of equipment is just going to be things like level of consciousness, how alert is your patient, is the patient calm, are they agitated, skin color. Your assessment first starts as soon as you enter the room. That's a rule that we've always had as a nurse. Tools to use for assessment are, most hospitals will use what's called a Dynamite. It's a multitasking machine. It does your blood pressure, your pulse, your oxygen saturation. It does all that at the same time in one reading. But of course, you can do them all separate with separate pieces of machinery. Blood draws also may be done in order to obtain and evaluate lab values. It's also important that the nurse asks the patient any concerns that they may have, so that way those can be addressed by the appropriate staff. The second step in the nursing process is planning. This is based on medical diagnoses that are given at the point along with assessment findings from this first step. The nurse is going to develop a care plan. Each care plan will have a nursing diagnosis supported by the assessment findings that the nurse has established when they were doing the data collection on that patient. They're going to follow up with measurable goals set by the nurse, and they're going to be within a reasonable time frame to achieve the goals and ultimately get the patient back to good health. During this step, the nurse will also develop interventions that will meet the patient's goals. When applicable, the nurse needs to include their patient in the planning of their care. So if your patient is alert and oriented, it's good to ask them how they may be able to participate to help get their health back to where they want it. The third step in the nursing process is implementation. This is when the nurse applies the nursing interventions that they've come up with. They're also called nursing actions. Two main types of interventions are pharmacological and non-pharmacological. Pharmacological are those including required medication administration. Non-pharmacological interventions are those that do not require medical intervention or medication intervention, examples include, but not limited to, like repositioning, ambulation, range of motion exercises. Those will be non-pharmacological interventions. The final step in the nursing process is evaluation. By using daily assessments, the nurse can evaluate his or her goals that they've made for the patient. The nurse needs to know whether or not the goals are being met. If the goals are not being met, then the nurse needs to change their care plan in order to meet the goals. And that can always be done in a collaborative setting along with a team of doctors, and may include respiratory therapists, may include physical therapy, occupational therapy. Now that I've taken you through the 4 steps of the nursing process, I hope that as a patient, you may be able to determine whether or not you are receiving competent care.
That's pretty good. There was one part of it